السلام عليكم ورحمة الله وبركاته. Good morning everyone. It's our pleasure today in Health Academy to welcome our international and national speakers, participants and audience here and on the YouTube to the first Patient Experience Forum in Saudi Arabia. This is a very critical and crucial moment, as this has a very direct contribution to the healthcare transformation and Vision 2030, and of course, to the Health Academy and Saudi Commission overall strategy. Please allow me to welcome my colleague and my brother, Mr. Yahya Al-Ammari, to introduce our speakers.
Thank you. Good morning, everyone. Good morning, everyone. Sabah al-khair. Assalamu alaikum. Thank you, Abu Abdul Karim. It's a pleasure and very interesting topic we have come across today. It's part and outcomes of the Health Academy approach to global standards and benchmark. If there's anything we have learned from the pandemic, is the opportunity to explore, share knowledge, exchange experience, identify areas for development. Most of the healthcare sector actually went to ground zero, and we were in many aspects ahead of the games, and we realize it's time now to scale up and bring a very good diversified portfolio of international partners. We group them under four categories to balance their priorities and perspectives when it comes to workforce and healthcare education. We group them under healthcare regulator, healthcare service provider, healthcare community and society, where Dr. Jason and Baird Institute is an example. And we try to increase and go beyond the Health Academy by engaging the communities, engaging the locals, ensuring the impact on the ground can be assessed and maintained and felt by not just the patient, by their family's member too. And what we explore today, that Baird Institute has been one of the leaders in the patient experience. In fact, they have their own established specialized journals on patient experience, which is something within the Health Academy we try to increase in terms of collaboration, research, findings, studies, to bring the gaps between the local and the global, yet customized to our priorities and the culture. It's a pleasure to welcome Dr. Jason. We appreciate the time difference in the USA and Saudi, and he's been very kind and supportive, and hopefully the next meeting will be in person when the weather allowed us to welcome Dr. Jason in Riyadh, inshallah. The stage is yours, and it's honor, a pleasure, Dr. Jason, the CEO and the president of the Baird Institute. Thank you.
Thank you so much, Mr. Ya. And let me just say Sabah al-Khairi. It is early morning here in the United States, and truly an honor to be with you today. This is an important journey and a historic moment, and I am humbled to be invited to be a part of the incredible work that the entire team there has put into not just today, but making sure that the model of care that you speak to think about the citizens that comprise the kingdom are acknowledged for the human beings that they are. And this is the topic that I hope to speak to today, the concept of to care is human and the work that we do overall. And I think, Mr. Yahya, as you were mentioning, we have all been sort of walking empty streets for over a year now. The streets of our cities around the world were laid bare and vacant by a pandemic that has challenged us at a moment to discover what's at our heart, what's at our core, what's important to us as people, as communities, as nations, as a global this community and world around how we come together to create the best in learning, the best opportunities for those that we care for and serve, and take care of those who show up in healthcare every day to ensure that happens. That's what brings us here today. That's what creates this historic moment. And it's around this concept of caring for one another that I want to speak to today, if we could. See, there's a great poet, Maya Angelou, who shared a quote that she said, if you find it in your heart to care for somebody else, you will have succeeded. And what we're talking about today is that capacity to take the power of education, to take a transformational model in the kingdom, to think about the model of care and the activated citizen at its heart, to understand what it is that will take us all to succeed. And I hope that I can paint a picture of what's happening globally, but also in the context of the conversations that you will have today, to understand how you are taking a significant stand and making a statement that you are here to make a difference in the experience for all that you care for and serve. You see, care is not just simply an idea. It really is a verb. It's an action. It's to feel interest for or concern. And that's what our hope is, that we take that interest, that we take that concern, that we take the actions that are required. And so, as you were alluding to, just want to introduce you to the Beryl Institute. We are a global community now, almost 60,000 people in 85 countries around the world. The journal that Mr. Yahya was talking about is read in, believe it or not, 200 plus countries and territories around the world, in a discussion of what it's going to take to change the nature of human experience through our global community. And in doing so, we have tried our best to build a field of patient experience, to think with an educator's lens, that when we think about bringing together a community of practice, we build a foundation, a body of knowledge, that we do the research that matters, and we think about how we certify people in ways that they can contribute. We create a system that actually has impact, that is measurable and evidence-based, that understands what it will take to grow each and every day, each and every individual to make a contribution to that human being that they touch each and every moment in healthcare. So if I were there with you in all the three sites, it's amazing to be together, not only in the three locations, but on YouTube as well. I would ask you all to raise your hands. How many people in the rooms that are watching are human beings? Because I have been able to ask that question in continents around the world. And whenever I ask that question, everyone raised their hands. We are all human beings. And when it comes down to healthcare in particular, when it comes down to this idea of the experience we're talking about, we are human beings caring for human beings. And that foundation is so fundamental. That foundation is on which we will build the future of healthcare, and on which I believe you are leading the way to do so in the kingdom itself. And so with that, I want to start with welcome. I want to start by saying Ahlan bika, that this really is the opportunity for us to build a global community. And this is a stand that you are taking to say, we are here to make a difference, not just for the citizens in Saudi Arabia, but for an example for the world of what it means to build a system that understands the human beings at its core. And so in saying that and welcoming you to this global conversation and taking the stand that you do in this historic moment, I think we need to put the context for experience in its best and proper place. So there's a story that I've heard recently, and I'll just use the name Mrs. Smith. Mrs. Smith was in one of our hospitals in anywhere around the world, apparently in room 301 in one of our facilities. And the receptionist at this hospital facility received a call about Mrs. Smith. The woman on the phone said, I'm trying to find out some information about Mrs. Smith. I believe she will be getting her test results back soon, and everything seems good. She should be discharged this afternoon is what we believe. And the receptionist does everything she can to find that information. She calls the patient's unit. She gets everything she can within confidentiality, and she gets back on the phone with the woman on the phone and says, ma'am, it sounds like everything you said is correct. She should be discharged today. And then going that extra step, is there anything we can do to help you figure out how to park at our facility, or where to find Mrs. Smith, when to pick her up? What this receptionist said is, on the other end of the line, she just heard a big sigh. And the voice on the other end of the phone said, honey, I am Miss Smith in room 301, and nobody ever tells me a thing around here. See, what happens is, no matter what we do, when we think about what we can build in systems and processes, if we let those simple things fall apart, if we miss those opportunities, then we are missing the experience that matters. When our patients are having to call our front desks to figure out their plan of care, we are missing the opportunity for quality, safe outcomes in each and every encounter. In fact, we have to understand when we're talking about experience, we are not talking about satisfaction. This is not how happy people are or how they feel in a moment. This is not doing everything the customer wants, but rather understanding what's important to deliver the best in outcomes. See, experience, from my perspective, experience, what we've seen around the world is something we have lived through. You're answering these questions in your activities this morning and throughout the day. It is the lasting story you tell. It's everything you perceived, understood, and remembered in your healthcare experience. And when we think about what that means, when we understand that from that perspective, it must be connected to all that we do in healthcare. For far too long, we have operated quality and safety, our cost management, our service efforts, driving outcomes in all these different buckets to manage the chaotic nature of healthcare in general. When we ask our patients and families, when we ask our citizens what matter to them, they want to see that we have them engaged in the process as partners. They want to see that our employees are cared for, engaged in the healthcare workforce. That is what we're speaking about from the standpoint of experience. All of that together is what encompasses experience. And it goes one level deeper to understand that the integrated nature of everything that we do in healthcare has an impact on the experience we provide. When we educate people about experience, it's not simply about engagement or satisfaction, but it is addressing the issues of culture and infrastructure and policy and the environments we create, and innovation and technology that we've been pushed to the brink on just through this pandemic alone, around how quality and clinical excellence undergird everything that's important in healthcare. And so from that perspective, the foundational principles of experience, if nothing else we take away to open our conversation, are based on these simple ideas, on interactions, on culture, on perceptions in the continuum of care. Because when we understand, and I hope we are still all human beings in the room this morning, human beings caring for human beings, the point of interaction is where experience happens. Sometimes now through technology, like we're doing even right this moment. But it is grounded in the kind of organizations we build, the systems that we support and create, the model of care that you're espousing and building in this transformation that is happening today. That culture ensures the best in interactions, and it happens at all touch points across the continuum of care. And the perceptions of those patients and family members that you serve, the care partners that they bring with them, are our ultimate barometer that matter. It is the sum of all those interactions. It's shaped by an organization's culture, and it is that influence those patient perceptions across the continuum of care. So with that foundation of experience, I think it's important to talk about why it matters. So I'm going to be a little bit of data geek as the academic that I am, and a bit of storyteller, if you'll indulge me as well. And there's a story as I was visiting a hospital not too long ago in São Paulo, Brazil. Thank goodness it wasn't during this most recent World Cup fiasco they had down there the other evening. I know we're all facing health challenges, but I was in a hospital in the heart of São Paulo, and I met a gentleman and this nurse that I'm standing next to, Veronica, and she said, I want to tell you a story about a family, a woman who was in our unit. This is the oncology unit, and particularly the palliative care section of this unit. And she said that I received a call from a patient. It was a mother of a 5-year-old daughter who knew she was on her last days of life. And her one request of all her requests of us was to ensure that she could, if in any way possible, spend that 5th birthday with her young daughter. And they did it with the miracle of science, with the amazing evidence that they were able to ensure that woman's life was able to hold on so that she could hold her daughter's hand, semi-conscious, to have the group together and have that birthday party in her room. And now, unfortunately, just a few days later, the mother passed away, and the daughter, about a week later, tugs on her father's shoulder, still in the midst of sadness and mourning, and says, Dad, I want to go back there. I want to go back there. And he said, honey, where do you want to go? And she said, I want to go back to the hospital. So he says, I'm not sure why you want to go there. There's so much pain. There's so much anguish, but let's go. And so they drive off, and she runs up and she finds Veronica, and she walks up to Veronica and she simply says, I want to give you this, a handwritten thank you note for what you gave me for my 5th birthday party with my mom. And then she asked her to come a little closer, and she said, let me tell you something. I know what I want to be when I grow up. I want to be a nurse. You see, when we teach people and engage people in the stories that matter, and the moments of learning happen in many incredible places. And it's what undergirds and underlines what's so important to people that experience healthcare each and every day. You see, what we learn through our data is that people around the world continuously tell us, yes, their health is important, incredibly important. Their well-being matters. That's what they expect from healthcare. How they are treated is the differentiator. It's the reality that they want to be treated with dignity and respect and communicated to in an effective way. See, we always believe, and I think the data continues to show us, that the quality outcomes matter, that people want to receive appropriate care. They want their health to improve. They want to ensure that their health care is delivered safely. But when we ask them what truly influences the experience they have, these are the things that they told us. They said, we want people to listen to me. We want people to communicate clearly in a way that I can understand. And I want an environment that's clean and comfortable, that there's courtesy and respect. And I have confidence in that healthcare organization, that healthcare system's ability to provide me the best in care in each and every way possible. See, these are all things that we must teach people to do. This is why the education around patient experience is so important. This is the opportunity that we have to build foundational ideas of what it's going to take to elevate our performance, to ensure that we meet the needs of our citizen at the heart of our efforts. The things that people said were less important were convenient facilities and good food and amenities and parking. I mean, now, yes, I think for a while people thought experience were these things on the right side of the screen as you look at them. These are the things that cost us money. And we're not saying they're not important, but they're not where we need to invest our time and energy. Where we can learn and grow and build is the things that will enable us to listen to people, communicate clearly, to treat them with courtesy and respect. You see, what we found out in this moment of pandemic is that experience, right now, the mandate for experience around the world has never been higher. Citizens of the world are asking for it. Healthcare workers realize it is where they find their purpose. And when we take it out of the equation, in a moment when people are feeling stress and burnout, we are actually ripping apart the very fabric that builds healthcare in the first place. And that is why you matter. Why, as educators, as caregivers, as people that are committed to a better healthcare system, you matter with incredible intent. You see, we've faced struggles in this last year plus now that have pushed us to the brink for healthcare workers, for our healthcare workforce, for those of us that support them. And what we've discovered in this moment is that, yes, while healthcare workers continue to be the most incredible people, I think, on this planet, hopeful, optimistic, motivated, they're becoming more and more burnout. We see it everywhere around the world. They are anxious. They are angry. And so we have an opportunity to understand what truly matters to the people that work in healthcare as well. They are part of that activated citizen at the core that will enable us to do what matters. And when we educate them around this purpose and support them in what it's going to take to execute on that in a way that matters, we can achieve great things. There was a story I was told by a gentleman at a hospital. He was delivering a tray and he overheard that it was a woman's birthday in the bed. She was an older patient, didn't have any family in the room with her. So she was alone. And she was talking to a nurse and he thought, wouldn't it be nice if we celebrated her birthday with her? So they ran downstairs, they put together a little birthday party, they checked her allergies and they checked with the nursing unit and they all came in the room and started singing this song to honor her on her 80th birthday, to celebrate her birthday. And the patient starts crying in her bed. And this gentleman, who had been in food service and healthcare delivering trays for 30 years, said, I was slowly backing out of the room. I thought that was the day I lost my job. I made our patient cry. And as the patient wiped the tears from her eyes, she looked at everybody in the room and said, thank you so much. That's the first time in 15 years anyone has ever sung that song for me. You see, when we listen to the patients that we care for, when we enable interactions and we empower people to make the best choices, we can make differences in lives. In fact, this idea of the birthday crew that emerged from this hospital is one of the most popular things in the entire community. They understand, not because it's a nice thing to do, but they realize it means they care for the human beings in their midst. And as we've asked through our studies again and again, what matters, we went to our high-performing healthcare units around the world, to healthcare units around the world, and we again saw the reinforcement that it's how we treat people. But what they also told us is this: it's that we build healthy, vibrant, effective care teams, that we take care of them. And it's why we're challenged at this moment and why we have a huge opportunity in moving from this pandemic overall. And while all the data that I shared with you, all the opportunities I think that we're going to lay out in your conversations over the course of your time together today is global in nature, we have to acknowledge that when we think about it from this perspective, while our commitment is global, our actions must be local. And that's what you're doing the things you're thinking about in your questions, the conversations that we'll be soon having with Mr. Iman, that we are going to have a great chance to discuss what that means for you. And that's how we together here in the last minute or two that I want to share with you about transforming the human experience. You see, we've been in a time, I think we all know, that taught us we cannot go back to the way things were. There's no normal to which we can return. It's pushed us to think about healthcare in different ways, that we can't just think about the silo of patient and employee or community as distinct things, but they are integrated in a common thread that is this idea of the human experience, of human beings caring for human beings. And I believe wholeheartedly, and as we alluded to with the journal earlier, that this focus on human experience is not a move away from anything that we're talking about today at its heart, of the patient experience at its center. But if we don't also understand the needs of those who show up to work every day in healthcare and the communities in which our healthcare systems operate, we can never truly perform to our maximum ability in delivering on the best in human experience overall. You see, our data shows that experience drives outcomes, and human experience does so with great and incredible impact, from the service we provide to the reputation that we have, to the way we engage our employees, to the way we bring new people into our healthcare system. And it calls on us to forge a new path forward with this idea that as human beings caring for human beings, we have to tackle the issues of equity in our healthcare system. We have to address the vulnerabilities of our healthcare workforce. We have to understand, recognize, and act on what matters most to patients. And what you are doing today, we have to collaborate through shared learning within and between organizations, systems across the world. That's why I am so honored by our partnership as we think about what this means, as we think about bringing together the Health Academy and the Saudi Commission for Health Specialties, the Beryl Institute, and organizations around the world, people around the world that are committed to this. It's through shared learning, it's through what you're doing today that will ultimately move things forward. It's why I hope that you all, as part of your effort, will also take a step in not only standing together for this Declaration for Human Experience, but acting forward into it. Because when we think about this model of human experience, of patient, workforce, community experience that links us all together, what we find, it's about commitment, it's about empowerment, it's about education, it's about having the vision for where we want to go. And that is everything that I have seen, heard, and learned about in the model of care itself. When we think about the activated person at the core, the healthy communities that we want to ensure, and then the system we build around it to ensure commitment, empowerment, education, and we are living out the idea of human experience overall. You see, there was a story I was told about a patient that was lying in a bed, and she went to reach for a cup of water on her bedside table, and that cup of water spilled on the floor. And she realized that could be dangerous for the people taking care of her. So she pressed her call light, and she pressed her call light again. And eventually the nurse walks into the room and looks at the spill, looks at the patient, and she goes to the phone on the wall. And who do you think she's calling? She's calling environmental services or housekeeping. And moments later, you hear this squeaky bucket coming down the hall. And as the housekeeper looks at the spill on the floor, looks at the nurse, looks at the spill on the floor, looks at the nurse, does another one of these, waves her over to the door of the room. And there, in the doorway, breaks out one of healthcare's loudest whisper fights of all times. And in this entire fight, they're just, that is a nurse-sized spill. I'm not sure why you called housekeeping. It's not a nurse-sized spill. That's a housekeeping spill. It's a big one, and you need to take care of it. And in the middle of all this, where is that happening? In front of the patient, in front of maybe their family or care partners, in front of their roommates, their peers walking up and down the hall. All these people are observing this. And as all of a sudden, in the midst of this whisper fight, they just hear this push. They turn and see the patient now sitting up in her bed with the pitcher of water that was on her bedside table turned upside down and water everywhere. And she looked at them both squarely in the eyes. They looked at her back and she said, "Is it big enough for you now?" That's what today is about. That's what this movement is about. That is why this conversation must happen and continue, because it has to be big enough for us now. It has never been more important than it has now. As we have struggled together as one world with one shared story in a way that we've never had before, about the fact that we care for people as human beings, and we must each and every day. Because if we take this step forward, as we teach people the way forward, as we think about the strategies and plans to get us there, As we acknowledge that at the heart of all we do, that we are human beings caring for human beings, only great things await. And that, I believe, is the journey we are on. And that is why I am truly honored to travel this journey with you. It's great to be with you today. I just want to say shukran jazilan, and here's to an incredible historic day. I'm so honored to be with you. Thank you so much.
Shukran, Dr. Jason. Thank you very much for such an insightful and inspiring point you raised. And where the patient's satisfaction is a part of the journey and is a part of multiple destinations, involve different factors, different elements such as communities and the healthcare workforce, and most importantly, the human aspect of it. And what got my attention, the top-rated percentage, where it says 64% the care to be listened to, 63% to be communicated to. So I think that's what giving them the confidence, the courtesy. That's what make a difference to them. And the promise we said earlier from our international partnership is to balance the global exposure benchmark with the local. That will be presented in our next honorable guest, Mr. Ayman, one of the Barrel Institute's council members. He's already now ahead, and he already linked and integrated with the global benchmark. However, he's one of the specialized in patient experience in Saudi. And he's a board, USA board certified patient advocate. We welcome Ustad Ayman, and he will take us through the importance of the culture aspect in the patient experience. Thank you, Dr. Ustad Ayman. The stage is yours.
Assalamu alaikum. Thanks for the introduction, and thanks for Dr. Jason. Thank you very much. I'm very proud to have here today and sharing some insight about the cultural and aspects in Saudi Arabia. So we cannot start talking about cultures in Saudi Arabia if we don't speak about our religions. The globally Muslim represent a substantial portion of society. Delivering high quality care to patients of the Muslim faith requires an understanding of the differences in cultural and spiritual values. The healthcare system of Saudi Arabia is mainly operated by non-Saudi healthcare professionals, and many of them are not Muslims. So why the cultural aspects is important for patient engagement and healthcare delivery. Let me give an example from non-healthcare industry about story of hairstylist salon in Cambridge received local award because of skills and effort to be cultural inclusive. The author visited the salon and surprised to find the window covered and no men. She asked the receptionist what was going on, and she informed her that a young Muslim woman is receiving services and that she cannot be seen by men when she isn't wearing her hijab. The hairstylist took the time to adjust the environment and changed her schedule to make sure her client felt comfortable and received the best service. So it's a question from my side to be shared. What if every healthcare experience could be modeled in this way? As a healthcare providers organization, when you respect culture, you are acknowledging that patients are capable of making the best healthcare choice for themselves and their families. Promoting cultural awareness among healthcare professionals is believed to improve their confidence and skills in providing holistic care for patients with different cultural background. Healthcare providers need to realize that they also bring their own cultural context to patient relationship, even if they don't realize it. Hence, culturally respectful organizations tailor their engagement strategy care education, materials to fit the patient belief, attitude, and needs. As a result, patients will understand their care, trust the answer given to their questions, and feel empowered to manage their own care or enlist their help for family or community resources. Healthcare is one of the main focus area of the Saudi Vision 2030 and National Transformation Program 2020 that seeks to improve the quality of healthcare services and facilitate across the KSA. Accordingly, the strategy objective of KSA Vision 2030 and National Transformation Program has been designed to improve efficiency and effectiveness of healthcare sectors in KSA through enhancing health, provision of comprehensive and excellent health service, and promoting healthy and sustainable environment. This effort will allow patients and their family to engage in evaluating the services provided to them, whether through the health facility and healthcare center or through virtual services, which will provide a good information of the services provided and best expectations. So we can find out where is the improving area. When talking about importance of cultural aspects, let us find out why or what is the importance of cultural aspects of patient experience in Saudi Arabia. In a time of increasing cultural adversity, it is essential that healthcare professionals respond by providing culturally competent care. The form of respect might be different from person to person and from culture to culture. Therefore, individual and cultural differences need to be recognized and taken into account. As well as we all know, the culture of Saudi Arabia defined by Islamic, Saudi people tradition, values, norms, customs, and social interaction are usually shaped by Islamic and Arabic culture. That's why the healthcare practitioners need to understand the implication of spiritual and cultural values for clinical practice. They should be aware of the need of modesty, privacy, and the appropriate use of touch. Culture can be defined as ideation, symbols, behavior, values, and beliefs that are shared by human group. Culture, therefore, can be shaped by many factors, including, but not limited to religion, race, economic status, level of education, and environment factors. Since the healthcare system in Saudi mainly operated by non-Saudi healthcare professionals, and many of them are not Muslims. So the question will be raised here, how does religion and culture harmonize in dealing with the Saudi patient to achieve the right care and patient care satisfaction? We can say the patient behavior and attitudes will be largely influenced by religion. Thus, it is conceivable the Saudi patient will have concern about non-Muslim healthcare practitioner in some research, so that kind of idea. So the practitioners who are not Muslim who take care, they are largely responsible for the care of the patient. So promoting cultures awareness among healthcare professionals is believed to improve their confidence and skills in providing holistic care for patients with different cultural backgrounds. Thus, cultural aspects play a fundamental role in shaping the patient experience with healthcare providers in Saudi Arabia. Let us find out what are the factors that affect cultural aspect of patient experience in Saudi Arabia. There are 5 factors that affect cultural aspects for Saudi Arabia, greatly contribute to overall patient experience. Logistic, diversity, religion, values, gender, and nationality. One of the main factors affecting patient experience is the communication barriers. Foreign healthcare professionals find it challenging to communicate with patients, and dignity is one of the important factors in communication with Saudi patients. Non-swift, for example, non-swift response to patient demand might indicate disrespected, or late responders might sign of ignorant or negligent. In research conducted in case A, it was explained by some participants that aspects of nonverbal communication were also not understandable, such as form of signs that were used and some facial expression. Not to provide adequate language training, this led to language barriers, and the healthcare professionals were forced to depend on translator, colleagues, and patient families, which negatively impacted on care. Not being able to speak Arabic meant that healthcare professionals found patient compliance to be difficult because they could not explain the benefits of following care advice. Recently, I heard that there is a program, and I have very glad to know about it, Abjad program, with teach non-speaker, non-healthcare but speaker, the Arabic. I believe that in Makkah region, I'm not sure if it is in overall the kingdom. So the healthcare also professionals, especially nurse, forced to depend in translator, which is timely even when relying basic information. In fact, translator were generally a problem, especially for the nurses. Yet translator could lead to inaccurate information. I want to say here also the difference between English and Arabic language spoken. The extent to the English accent by non-English speakers, like for example in the Filipino or Pakistani, allied to these Arabic speakers accent in different among Arabic countries like Egypt, Lebanon, Morocco, or another country in the Middle East, which makes sometimes a problem between patient and healthcare professionals. Talking about the religion diversity, the Islamic faith can influence decision-making, family dynamic, and healthcare practice. Hence, healthcare professionals need to be aware of fasting and prayer privacy and touch issue, and even worship rights. Healthcare professionals are not aware of Islam religion will think the sudden change to the patient medication schedule routine in Ramadan, as an example, that might harm the patient health. Or if the healthcare professionals also not aware that there is a specific time when the patient will be praying, and then can adjust the treatment plan according to patient time to avoid bothering in patients. Understanding the Saudi belief will assist healthcare professionals in delivering appropriate healthcare in culturally sensitive manner. This can be accomplished by understanding religious implication, respective of family, health, illness, and the influence of traditional medicine and privacy concern. Therefore, all health practitioners should be able to provide culturally competent care. When healthcare professionals interact with the patient, they should follow certain guidelines wherever possible. This include minimize eye and physical contact between healthcare worker and patient of opposite gender when possible. During hospitalization, for example, modesty and privacy should be respected, and ideally patient should be cared for by a nurse or a doctor for the same gender. This is particularly important in maternity and gynecological care. Where gender-specific care is not possible, a male professional caring for female patient should always be joined by a female staff member or one of the physician adult relative. Talking about national diversity is really my favorite. I'm not sure if you will agree with me or with it. The national diversity was identified as being important. In a qualitative study on Saudi women's experience and perception of maternal health service, the participant had preference on non-Saudi nurse, especially Filipino and Indian, for an example. They perceived the nurse as a maid for housekeeper. From their point of view, the role of nurse is changing blanket, help them to enter the toilet, also give them the sleepers. According to them, the example mentioned service are attainable only by nationalities such as Filipino, Indian, and not with Saudi or other Arabic nurses. Therefore, it is important to cultural diversity in doctors and nursing school to understand also the culture of non-Saudi healthcare professionals to avoid stereotyping. In the end, the Saudi healthcare practitioner holding the same culture in Saudi population. So what the foreign professional must do? Knowing these 5 factors and understanding of this perspective should inform healthcare professional effort to achieve cultural competence and deliver care that is culturally sensitive. In order to attain the holistic care, the foreigner healthcare professional should professionally educated about Islamic Arabic culture, understanding the belief and tradition, as well as must display cultural competence and develop appropriate cultural communication to provide quality care to the Saudi patient. Understanding the different cultural facts will also help to reduce possible incidents of cultural conflict that could hinder treatment. It is also important to integrate cultural values in the care process to reduce incident of cultural shock. Finally, cultural generalization will not fit easily in provision for care for every patient. But awareness of broad patterns can give practitioners starting point from which to provide appropriate care. Promoting cultural awareness with the healthcare setting increase the ability of healthcare professionals to deliver holistic patient care. In this regard, knowledge about patient cultural aspects play a fundamental role in improving patient experience. Generally, the patient experience provides the framework from which decisions are made to transfer national healthcare service. The national healthcare transformation needs patient experience data, area of improvement, and patient expectation to come up with the best healthcare practice to improve the quality healthcare service. Look about patient experience provide critical information that national healthcare use to integrate patient-centered healthcare service. We can see the patient care is healthcare defined as care profession that is consistent with the values, need, and desire of patient, and this will be achieved when clinician involve patient in healthcare discussion. Patients are integral part of the healthcare industry. Their experience determine where they will return in seek more healthcare service or not. If the patient experience is positive, they will return. If negative, they will not. Therefore, patient experience is important in national health transformation, and patient experience is key for promoting patient-centered care and culturally competent care necessary in case A. When we're talking about the patient experience, how to enhance the safety, I'd like to say here to emphasize that enhancing patient experience is strategy of enhancing healthcare quality and patient safety practices. Positive patient experience reduce readmission of patients, which consequently contributed to reduce workload for the healthcare professionals. Some research in case showed that improved patient experience in linking to reduce medical malpractice risk and result to improve healthcare worker satisfaction, reducing inpatient turnover. The patient with positive patient experience is likely to respond to treatment well and have positive outcome, which is satisfying to the healthcare profession as well. So better patient experience enhance better self-care management quality of care. In the last part, I'd like to emphasize how the patient experience is important in the healthcare industry. So patient experience provide insight into measures that can be taken to increase the quality of healthcare service. Improving the patient experience starts with engaging people before they become patients, including family members in the circle of care, and proactively promoting preventive care can help catch disease early or avoid its onset. Improving patient experience is associated with positive finance indicator, which is essential for enhancing the healthcare financial gain. And thus, improving the patient experience is vital to patient satisfaction. And thank you very much. Okay.
Thank you very much, Mr. Ayman. Another insightful and aspiring points raised, mashallah. You've covered the importance of the local culture, the alignment of those aspects, as they play a really fundamental role in shaping the patient experience, such as faith, belief, religious practice, fasting and prayer, and the aspirational values for peoples and their families around them, and even the visitor as part of the belief we have. And the other point got my attention is the backgrounds, the linguistic, the communication of the customers, of the workforce when delivering the customer experience. Very interesting to know clearly the culture now, as Dr. Ustad Ayman mentioned, become one of the competencies we need to consider it and include in the learning journeys of the patient experience when it comes to the knowledge. Now, as we promised earlier, we now will put together the locals and the globals in next 15 minutes to balance the priorities, to take the consideration, and to give us the best fruits out of those two discussions. So we will come back Dr. Jason, Mr. Ayman. They will take us for the next 15 minutes, how we balance this, and inshallah we'll have a break at 10 for 15 minutes. The stage is yours, Mr. Ayman, Dr. Jason.
Thank you so much. And I will only say that brilliant as always, Mr. Ayman. I think that you have an incredible champion there that has lived this work and gave you incredible insights from which to really think about this conversation. And I think Simon knows we have worked diligently with a global network of people to really raise some of these critical issues that he touched on today. And I would just reinforce, Mr. Yahya, what you said about culture, about the cultural realities, but the cultures of the organization that we build. And I think the culture that's so critical to the model of care that is being framed overall. And I was just curious from your perspective, I mean, we've been on a lot of calls together talking about this. As you think about some of the critical drivers of culture, and you think about what it will take to maybe translate a lot of the conversations we've had at a global level into really influencing the way we educate people and then transform the system there. What would you say from your lens are some of the critical things you've seen are the levers to building stronger, more vibrant cultures that are at the heart of the definition of patient experience itself?
Because the first, we have to admit that we have some unique culture in Saudi Arabia. Okay, now reading the book and the culture of another like USA or another countries with lead in patient experience, and so how they're dealing with the cultural aspects and cultural things. Believe me, there's a lot of things from my experience I saw it's similar to what's in USA, but how we gonna put it in different frame? The problem here in Saudi Arabia is they are a little bit more conservative. Like if you compare Saudi Arabia with other Muslim country, you can find that Saudi countries is more conservative. So though we already things change very fast here in Saudi Arabia, but still we need to make some new, we can say, a new module for us. And to work with this one, we should work with a lot of local people. To work with local people, the local people should believe on this concept in the first place. So if they not, which is from my personal experience, I find really, I appreciate the people here around and everybody and the support now for the Academy, but from my really personal experience, the people, they said, this patient experience, everything can find it in our religions. Okay, and if I agree with them, so why you need the police? Why you need, if it's okay, if everybody are following the faith for Muslim or other kind of religion, so why they need court? Why do you need a police? Why you need another government security departments? So because we are not really following the religion, that's why we need to follow it in different way. So basic experience, if it is part of Muslim or the other belief, okay, so that's follow the basic experience. Let's go with the basic experience. So with the basic experience, in the end, you will go back to the religions. This is one of my concern.
It's powerful because I think to your point, and I feel fortunate, like I said, to stand in hospitals as I shared in Sao Paulo, or work with our colleagues in Singapore or in Australia. And I think you're right. The awareness of local cultural norms, the awareness of the influence of the demographic structures of the societies in which we operate are so critical. So that, I think, becomes part of it. And at the same time, I think what you're alluding to as well, I think is important, that there's some fundamental principles that tie us all together as well, I believe, right? This sense of recognizing the human being that we're facing, that we might have to do it within the cultural norms that we face, or sort of the religious parameters by which we guide ourselves, but we still understand the person in front of us is a human being that wants to be heard, that we have to figure out, as I think you talked about, find the right ways to support people in having effective means for communication, that we still, I think, at our core, no matter where we sit in the world, have this desire to, I would hope, not only be treated with dignity and respect, but treat people in that manner as well. And so, for me, it's an interesting balance as we think about how we educate people in this, how we start to wire this into the work that we do. It always brings up a challenge for me. And I'd be curious, hopefully this will come out in the conversations, that if we make patient experience, then, like you said, something else to do, it's something people can choose not to do at the same time, right? So if it becomes another in the list of things we ask people in healthcare to do, it becomes too much, or a burden, or a distraction from healthcare. And I think the part of the cultural foundation of an effective experience effort is building the cultures in our organizations. I think it's what's happening in the model of care by putting the activated citizen at the center to say, patient experience isn't something we do over here, but we actually provide an experience each and every day for the people that we care for. And if we're going to educate people, if we're going to build the processes and the programs to do that effectively, we should hold that reality as well. And I'm curious from that perspective, then, how you see the blending of the cultural, from the cultural competence standpoint, to the realities of addressing sort of the human standpoint that it's required to effectively deliver a positive experience outcome.
Yeah, you see, that's why I believe to enroll to make this happen. Working with the basic experience globals, hosted by University USIP, is very important now. So as we discussed before, so our aim is really to give official educations. One is our part of our objective, official education, and a right concept for implementation, the healthcare, the basic experience in healthcare in the cantons. And that's why you are working together in the Global Council, that's to have a strategy. So how to gonna engage all the people? How we gonna give, to put the basic experience in the right official track. So because now we are working is like if everybody almost working alone. So it is,
Yes.
it's known as one organization or institution, but I believe now maybe the Health Academy will lead that in Saudi, is hosting the basic experience concept and need really a powerful institution in all countries, because people, if they're working individual, then in the end they will not, they cannot have the power to do what they are believe it's right to implement the basic experience. So I believe working now in education in how even to embed it, the basic experience courses, maybe in the education level. For this example, I want to mention now, I'm working right now with a great team, almost to finish 80% of that research. The aim of that research of to come up with a recommendation with the nursing school of the important to embed the patient advocacy courses in their curriculum. And this one of what we are going to working in our global, inshallah, so we can spread and help the basic experience concept to be more power in that only if it is basic experience have empower for implementation, that's the time only really we can say we can have a result or outcome or benefits from all our effort. Because in the end, I believe if whatever we do and whatever we implemented, if the thing doesn't reduce the patient suffer, so no mean for what you are doing. And we cannot really go to that level if you are not doing this in a very official way in any government or in any country, or you don't have really empower, okay, to do this one. It's not there.
I would just agree. I think that, I know we just have a couple minutes left, but I think that consistency that you speak to is so important. And I believe it's a challenge that I've seen around the world that people are still talking about, is how we embed the learning of what experience is, how we address patient experience across our health professions. So from the allied professions to our health administrators to our policymakers, that the realities of what it's going to take to truly affect an effective experience outcome, and I think as you aptly said, and I think I suggested as well, it is the fact that when we get good data, that when we think about this as an integrated effort to impact quality, safety, outcomes, that has significant financial implications for our health systems, that enables us to be more effective with our resources and care for more people in more efficient ways. When we can educate people around those same ideas across the segments in an interdisciplinary way, and also create professionals that can lead that idea forward in our institutions of care, then we build a network that really creates a sustainable and vibrant opportunity for impact and outcome. And I think that's what's so exciting, I think, about what you have worked so hard to do, what this entire effort is. And I believe the conversation that you have for the rest of the day today will lead us forward to as well. So just again, I would just simply say congratulations on this incredible work. And I think that we will all continue to learn together. I know I have as much to learn from the things that will be shared today and beyond as everyone else around the world will. And there's great contributions that will come from so many places.
It's really very great to be with you on this stage. And I just want to say, I believe now it is maybe 12 or 1 a.m. in United States.
That's 2.
When you are doing that to me in the Zoom meeting, I woke up.
Yes, we switched.
I tell it's 6 a.m. But now I beat you because it is 1.
Yeah.
So thank you very much for enjoying. Appreciate it.
Thank you, gentlemen. Very inspiring topics and debate. We do want to keep you long for the break. What got my attention again in this last discussion is the global strategy, and where is the role we can play in Saudi Arabia to shape the strategy and to incorporate it into our health transformation plan. Is one of the mega multi-billion projects. Therefore, our next guest after the break will be the head of the Patient Experience Center in Ministry of Health. And we'll keep you to refresh, and then we'll go through some more details. We'd like to recommend and remind our colleagues in Jeddah, Riyadh, and Dammam to keep collecting the engaging activities. The two questions we'll discuss later on. Thank you very much. Enjoy your break, and we look forward to see you after the break. Thank you. Our leader is coming in person now to share with you. welcome you.
Yes. Thank you so much. 2 a.m. My pleasure. Outstanding. Thank you all. Look forward to learning from you too. Best of luck on the journey. Thank you very much. I'll be signing off. Thanks.
It's the second part of the forum. Thank you for joining us after the tea break. We welcome everyone. The summary of what we covered so far has clearly identified the patient experience journey involves different stakeholders, multiple competencies, variable aspects ranging from culture, faith, communities, regions, families. Therefore, our leaders at the Ministry of Health have put together the Patient Experience Center to take the role and lead and support as a key stakeholders. Our next speaker, Ms. Iman, she's the Director General of the center. She will be taking us through the influence they may support us with in bringing the best out of the patient experience within the healthcare community. We thank Dr. Iman, Ms. Iman for her time, and the stage is yours, Dr. Iman, to introduce yourself.
Thank you so much for the introduction. Assalamu alaikum wa rahmatullahi wa barakatuh. I'm really happy to be here with you today, and it's a great pleasure to participate in this event. I would like to also express my appreciation to the organizing team, all speakers here at the US. It's a pleasure, and it's really it makes us really happy to have the feeling and the sense of life coming back to normal somehow. Inshallah, hopefully soon it will be in a better situation where we can be physically all together to continue our great efforts towards improving patient experience. Today, inshallah, I'll be sharing with you a very simple presentation. My main focus will be on influencing healthcare colleagues on PX, or influencing healthcare via the introduction of the concept of person-centered care. We always say that person-centered care is for all. We'll never create an exceptional experience for patients without creating an exceptional experience for providers. If we start quickly by just taking you through the journey of the PX Center, or MOH journey in improving patient experience, just to give you a brief and a background on the effort that has been done and continue to go as we aspire high together. We've started in 2018 by establishing the Patient Experience Center. We defined the scope of the center with the main focus on engaging families and patients to be part of the design and the evaluation of healthcare services. And most of you are familiar with the Patient Experience Measurement Program that started early in 2018 with the partnership with the Press Ganey, where we focused on defining services, healthcare services, and mapping journeys for main services and sub-services, and conducting surveys to understand where do we stand today and what are the drivers for patient experience nationally. As part of this effort, we focused on promoting patient advocacy programs, for example, focusing on the patient's rights, raising the awareness through campaigns and so on. There is also part related to creating a platform to encourage families and patients to be part of the decision making. For example, we've established the families and patients and families advisory councils across the kingdom, where we have patients and families sitting around the table, this decision-making table, and helping in improving the services provided to the community. Efforts continued, alhamdulillah, and we've seen great performance, as you can see on the presented graph. The more we advance, the more we improve, the more challenges we face as expectations are rising from our people. And definitely we believe and we know that they deserve the best, so the challenge will continue, but with all joint efforts and applying best practices nationally and internationally, inshallah, we will get to our objective. By the beginning of 2020, we were able, alhamdulillah, with all the data collected from the patient experience measurement program and the understanding the current situation and the gaps within the system that might hinder our ambitions towards making patient experience as a core principle in the healthcare system, we were able, alhamdulillah, to put together our own definition, MOH definition, where we see we perceive the care to be personalized care to patients and families that is delivered by proud and engaged healthcare heroes. And this emphasizes the importance of focusing on healthcare heroes or providers and investing in them as a main stakeholder and to assure that they have all what they need to in order to support this purpose. We were able to craft our promise and our purpose, and definitely, as I mentioned, it's human-centered care for all. We were able to also define or draw our vision on PX or of PX in Saudi Arabia, specifically in MOH, and we aspire to be a international benchmark, inshallah, in health, in PX practices, inshallah, by the end of 2030. All these dreams and aspiring visions, inshallah, will not be achieved without breaking this down into an effective strategy that takes into consideration different levels. As you can see, we have some parts of the strategy focusing on leadership and how can we invest in leadership by assuring that patient experience is always sitting as a strategic priority. There is part related to staff, providers, including PX staff. What do they need in order to help us execute that ambitious strategy? We know that we need to promote the values of delivering care to everybody as a family. We need to also explain what's in it for them to adopt patient experience practices and person-centered care, what kind of benefits we are getting from that, and how are they contributing to this objective. And of course, there is the focus on families and patients, where we need them to be more engaged, more active, more responsible, and take the lead as well. If you allow me to just maybe borrow this definition from Plaintree on person-centered care, and we know that person-centered care, there are multiple definitions out there, but I chose to share the Plaintree, and if we summarize it, it's not hospitality, it's not satisfying patients. Person-centered care is actually creating joy in workplace in order to support our people to bring their best, to help creating that or impacting the health outcomes and impacting the community in an advantage way or in a very positive way. So it's a very comprehensive view of care. It's not only focusing on satisfaction and pleasing patients, it's much more beyond this. So if we summarize it, there is a part related to caring for patients, part related to caring for the community, and of course the part related to caring for the healthcare providers and staff. So why do we need to bring this concept to our organizations, and why we need to focus on person-centered care? We all agree that objectives related to improving quality, efficiency, effectiveness, as well as patient safety is definitely always a priority, but why do we need that aspect? Simply, if we look at quality improvement by focusing on processes only, yes, we might start making results and realizing some gain. However, if we consider sustainability and long-lasting results, definitely we need to focus on the motives and the commitment of people to continue delivering this care with high quality and putting always the patients at the center of the service. So it's very important to consider the human aspect if we're looking at sustainability, long-lasting results. We can summarize the previous slide that there is a very important component that we need to invest at. Yes, alhamdulillah, يمكن, or perhaps for the past 3 years, was a huge focus on patient experience, introducing the concept, the culture, what is it, the definition, correcting a lot of misunderstanding and mixed messages behind what is patient experience, is it satisfaction, do we need to please patients, do whatever they ask. Alhamdulillah, we've reached a great level of awareness, and we believe that it's the time to make the right balance by looking also at the provider's side and the experience of providers and what do they need in order to deliver the best care to our patients. There are multiple studies conducted to tackle this specific area, and I chose this by Gallup, but there are a number of great studies done related to the similar matter that are recent, one of them by Harvard as well. But the study conducted by Gallup focused on a very important component, that if you need to improve patients' experience, you need to start with focusing on employee engagement, not vice versa. And I think it's very important. We might think that if I have high scores in patient experience, definitely I will have more engaged employees. It doesn't work like that. It's the opposite way. So we need to focus on our people, understand the needs, what do they need, what capabilities, what kind of empowerment they're looking to get in order to take this forward. So the employee engagement surveys that were used in this study, they were focusing on a number of questions. But I choose these 5 questions, and I think they're the most critical questions that we need to focus on. And in 2019, we've done there was a study or survey conducted at MOH, and we did get similar results where we did see that these items were highlighted as priority. So people, they just want to know how do they contribute to the strategy, how my role is contributing to the overall strategy or the organization strategy. So it's very important to make sure that the mission, vision, and the objectives are well communicated to people, where they can understand exactly what is the link between my role and the objective and the vision of my organization. It's very important that to create an environment where we encourage creativity, encourage that people, they do their best, they try, they might make some mistakes. There is a certain level of mistakes accepted to learn and grow. It's very important as well to make sure that we have create that environment of that embraces teamwork, where we have our team members we are all working towards one shared objective, and we get the proper support we need from our colleagues, as well as the relationship with our managers. It's important as well to empower and enable people by providing with the equipment, the material, whatever they need, even training, in order to deliver the best care they could. So how can we influence, or how can we drive engagement? We can summarize it in these few points, and you can add to them depending on every organization had a different situation and priorities, but I can summarize it according to the previous study and also with our experience as MOH, that it's important to create the trust. It's important to understand the role. It's important to, as well as to have the opportunity to grow, to improve and develop the relationship with manager, and so on. So creating the real impact would definitely require understanding the motives, what motivates people, their beliefs, and what kind of beliefs they have that might be hindering or creating an obstacle or challenge towards the objective we're desiring as an organization, and how can we tackle this by addressing their concerns. So it's very important to also consider this aspect. I would like to conclude with some of the initiatives that we started with in the few last years. One of them started in 2019, and one is in 2021, which is Rahma. These are focusing on embracing the great values that our people have and the a great and exceptional care that they provide. So we have, for example, the outstanding PHCs. The outstanding PHCs is based on certain criteria, mostly on employee behavior. So we encourage people to deliver the care with the best behavior attitude they have. And of course, there are aspects related to commitment and the compliance to certain quality standards. We have also in Gedderek, which is We Appreciate You, Health Heroes. It's related to the program, the PX measurement program, and it's focusing on selecting those who've been recognized by patients to deliver an exceptional care. And the last is Rahma, or Mercy, and it's focusing on the nursing care, where we choose or identify the top performing facilities in nursing items within the PX measurement program survey, and we recognize them, and this is a quarter award. Thank you very much for your time. Just for the sake of the time, we need to conclude, and happy to get your questions later on. Thank you so much.
Thank you very much, Ms. Iman. What inspiring, promising developments, setting up the national benchmark, driving the standards, starting from identifying what's patient experience, a comprehensive, covering even the families, delivered by proud and engaged workforce. I think the introduction of the Person Care Center itself, bringing to the community that the regulator, the leader, Ministry of Health, are taking a very important initiatives. We started earlier by bringing the global benchmark from the subject matter expert. We debated this with the local expertise, and we covered by Mr. Iman key stakeholders in terms of strategy and national standards. Now we have another key element, which is people from the ground. People has led a function back 2013. Dr. Ali, he was one of the first pioneers and leaders who became the director of the patient experience at King Fahd Medical City. He will take us through how it looks like, how it feels when you deliver this experience on the ground. The practice may involve the challenges, the translation, the conversion of all of strategic drivers on the ground. We welcome Dr. Ali, and we're honored to have him with us. Thank you, Dr.
Bismillah ar-Rahman ar-Rahim. Alhamdulillah wa salatu salam ala Rasulullah. Thank you very much, Mr. Yahya, for the introduction, and I'd like to thank the committee for the kind invitation. And I'm very delighted to be part of this team who's presenting today, hoping to help in improving and shaping patient experience in the kingdom. So let me start with a story. A patient came to the healthcare organization that he follows there because he ran out of medications. So he came asking for refill of his medication. So he headed to the pharmacy. Unfortunately, he wasn't helped by the pharmacist because there was no prescription in the system. So he was asked to go and try to find the doctor. So he tried to call the doctor through the reception. There was no response. So he went to patient affairs. They couldn't help because they asked him to go to the website or to the application and apply for a refill of medications. He doesn't know how to do that. Nobody helped him. So then he went to the patient relations, thinking that they would be of help. Because as the name says, patient relations, so he expected that he'll find the solution there. So they said, unfortunately, we cannot help you. Let us try to call the doctor. They paged the doctor. There was no response. So over 2 hours, he met about 6, 7 people. Nobody could help him because of many things. The first thing is the system does not allow. He has to do it in the electronic system, and there is no way around it. The other thing, poor responsiveness of the team. The doctor did not respond, and the other people who he met, they felt this is not their problem. He has to solve it himself. So after 2 hours, he has to go to the director of the hospital and raise a complaint. And do you expect that this patient will be happy about the service? Do you expect this patient will recommend this hospital for anyone in the community, let alone his relatives, to be treated there? No. And if that patient has an opportunity to go to another hospital, he will. Unfortunately, sometimes the patient has to follow that hospital, and they have to do it even if they are not happy. So this story that I am aware of, I'm sure every one of you is aware about similar story. And thousands of patients are facing the same problem. And the solution is simple: to have the patient experience thinking in every mind who works in healthcare. Even if I'm not a patient experience, if I don't have a patient experience title, I'm not a patient experience manager or patient experience specialist or patient advocate, being in the healthcare means we are there to help and serve patients. So my colleagues who spoke so far in the morning, they stressed on this point, the concept of patient experience, the importance of culture, how to influence people to be believing in patient experience. And I hope through my presentation I'll be able to just explore some functions of the patient experience team that will make patients really having positive experience. Okay, so what's patient experience? We cannot say anything after Dr. Wolf. He spoke in the morning, and the widely accepted Berlin Institute definition focuses on the culture. And the culture is us. Culture is everybody in the organization, not only patient experience staff. And the idea is to move from a medical model where the provider is the focus, where the director is the focus, where the doctor is the focus, to a system where the patient is the focus. If those people in the pharmacy and the story I just mentioned have that feeling that the patient is the focus and we are here for patients, I don't think that patient would have faced that 2 hours difficulty trying to find the medication that he needs. And at the same time, we have other features like, patients are engaged. We have to focus on the human aspect, not on the disease. It's unfortunate that when we talk to patients, we focus on the disease. We forgot that the disease is part of the person, not the opposite. So there are many positives that patient has that you could build on. Build their self-esteem, build their trust, build their confidence in themselves. If you just keep talking about the disease, they will feel that I'm a diseased person. People look at me as a disease, not as a person or a human. Patient experience role, and when I say patient experience role, us as providers, our role is to close the gap. Patient expects something from the organization when he comes. Expects respect, help, support, information, engagement. So if we fail as a system to provide them with that, there will be a gap. And the bigger the gap, the more negative the experience. This is why we have to understand what do patients want. And as Dr. Jason mentioned in their report, he just mentioned in the presentation that was published 2017, what do patients ask for? It's not a nice building, although it's important. It's not a nice food, although it's important. It's not like amenities, parking, important. What's more important, treat them as human. Listen to them, talk to them, explain to them, engage them, and so on. So why invest in patient experience? Because it impacts all the healthcare system. When I system, it means patients, providers, individual providers, healthcare providers like systems, like hospitals, clusters, and also the system as a whole in the country. And patients who are engaged or having positive experience will be having positive and very good, excellent outcomes. They will be readmitted less to hospitals, which is a very important measure of efficiency of the hospital. They will have less medical errors because of good communication and engagement. They will have better care coordination. They will have less suffer of consequences, and so on. Uncountable number of good outcomes if patients have positive experience. Let's focus on something which is very important. Mr. Iman talked about the influencing people. I'm talking here about team, so let's focus on the human aspect of care, not talking here about human aspect of the patient, but when you say about patient experience, technology is not everything. Some people, they think that, oh, we brought the latest, bed in the room, but we forgot to be empathetic with patients. We brought the very advanced appointment system, but we forgot how to respect patients. Technology is very important, enabler, but it's not the ultimate solution. So always think that we are dealing with human when we talk about patient experience. So here, the key dimensions of patient experience, there are 3 important dimensions. Emotional, how do we make that patient or family feel at the end of the counter? Do they feel engaged? Do they feel respected? Do they feel somebody communicated with them? And clinical, what do we do in clinical care? Then physical, which is the environment. The two first dimensions, emotional and clinical, it's mainly human-driven. So human part of the experience is the main part. Then in the other 5 P's framework, if you see the 3 on the left, provider, physician, personnel, it's human part of patient experience. So this is why when we talk about team or when we talk about influencing people or the providers, we mean it because we need to focus as leaders on the human aspect of ourselves. It's not enough to give the patient access to care or just give them the latest sort of medical therapy without the human aspect of our care to them, which I just mentioned. So after this introduction, the team, you'll find different definitions, but the team is people, number of people, with complementary skills. Skills here means good communication, conflict resolution, caring, and so on. We have to have commitment, and commitment comes from believing in a common purpose that we have to help patients. Then there'll be goals, and we have to be accountable. We have to work together and hold each of us accountable towards achieving those goals. So in that study I just mentioned by Dr. Wolf, 2017, one question was asked in a survey to an organization, about 230 organizations. What do you see as the strength of your current patient experience structure or system? It's highlighted that having and maintaining a patient experience department and team. So if you cannot claim as healthcare provider that you have patient experience system, if you don't have a dedicated team, well selected, who have the features we just mentioned, and I'll elaborate more. So benefits, I just mentioned that quickly. So benefits of effective teamwork, it goes beyond the patient benefits. It goes beyond the team themselves. So it benefits the team. They will be engaged, they will be satisfied, they will be also having well-being, and this is very, very important, especially these days, and that has been mentioned also by Dr. Wolf. Burnout is something that has happened over the last 2 years because of the stress we have been all going through in the international practice. So if you have a very good team who have really the values, the good communication, that will reduce the burnout and the stress. Patients will benefit from that team. The organization itself will benefit from that team. So having a team is very, very crucial to the success. What makes a good team? We have to have a purpose, and the purpose is very clear, to help patients. Please not to forget the important point that Ms. Iman mentioned, which is also it's very important to help the team themselves as providers. The team has to be helped by providing them with the resources, with the training, with the respect they deserve, and so on. So the team has those features: transparency, speaking openly, they need to have the skills, the personal styles, and so on. Is it easy to create that team? It's not. And but to do it, you need to have the intent and the purpose why we are doing it, which is helping patients. You need to have hard work to look for the team members and train them. Willingness to change the mind, change not only the offices and the furniture, change the way they think that team thinks, and make sure that they have really embraced the patient experience concept. Measure the success and so on. You need to have that. For that, you need to have good leadership that believes in patient experience. Clear direction or division of labor and tasks, training, and team supporting culture. I'll not go into details, but the functional dimensions of patient experience team are many. It's not only one it's not sort of office-based business. It is a field-based business in addition to office. They need to help in improving the service, being advocate for patients. And they need to measure and also work in the measurement. They need to do training, volunteer services, and so on. So every function in the hospital can be tailored to help patients improve their experience. They need to have emotional and practical support in some cases, some patients, confidential advice for some cases, provide information, and help resolving problems like the complaint management. There is proactive and reactive. When we say complaint management, usually it's a reactive. A problem has happened, and we'll try to solve it. Proactive, we are looking to ways where we could prevent problems from happening or complaints from being filed. So why patient experience scope is wide? Because we have broader commitment. It's not just the function, it is everybody's job. We have to focus on the needs of patients as well as the needs of the healthcare providers, and culture aspect is very important. Background, should the team be healthcare providers, doctors, nurses, technicians, admins? This study showed that it's not a must to be a healthcare provider. There are 37% from clinical background, and this part here is admin part. And even there are people who lead patient experience who are not from healthcare system, from hospitality, from banking, from other. It is a belief, not a certificate. It's not a job description. It's a belief that every patient at each encounter, at each touch point has to be helped. Probably this is the slide before the last one. Patient is part of the team. This is a very important part. Before, we were having the paternalism where the patient is outside our system and we'll just cook everything, then we'll pass the decision to the patient. Patient will be just receiving our decisions. Here, we moved a bit patient-centered, he's adult-centered, but still we are working, then we get everything directed to the patients. But here we are his partner, so he's interacting, getting out ideas from him and back to him, and he is part of the team. And I hope that this is what we'll be reaching to. This is when I say the non-formal team, just 1 minute here, I'll finish. So everybody is a team of patient experience. So there is formal, who are patient experience, who have the title, non-formal, who are everybody in the organization that takes care of patients. Culture is very important. It is how we do things around here, but not enough. Why we do things around here. Common purpose. Culture is very important. Good to have strategy, goals, objectives, but you need to have values, practices, behaviors that will form the culture. Okay, so it's not easy. However, the team can be failed if there is no clear vision, if there's lack of role clarity, no resources, lack of commitment, poor communication, and so on. It could count many and many hurdles or obstacles to a successful team. So you need to address all those as patient experience. I think this is the last slide. Thank you very much, and I'm ready to take any questions.
Thank you very much, Doctor. I couldn't resist to enjoy and give you more time to listen to the statistics. What I like most, inspired me about Dr. Ali's presentation is he started with the solutions. If you notice, the challenges was the last part. He talked from experience. You've seen it since 2013. And the real cases he come across, it got him to identify what exactly need to be in terms of proactive and things ahead. The teamwork, the 5 Ps, that's another my favorite part. The patient experience is a journey, and this journey does involve multiple people to deliver. The accountability of the team, the common purpose, and the support they expect from the management all the way from the top down, as he mentioned. MashaAllah, the measurement and how you bring together the criteria to take it to the next level is not about pass or fail, is taking it further, upgrading and going higher. Thank you very much, Dr. Ali. The other guest, it would be a good representation of what would a patient experience should look like within the transformation model of care. How they would fit. What's the preparation? What's the expectation? Dr. Samah, she's the Executive Director of Model of Care in Mecca Health Cluster. It's an honor to have Dr. Samah with us. And please join me to thank and welcome Dr. Samah. Thank you. The stage is yours, Dr.
Thank you, Dr. Yahya, for the introduction, and thank you for the organizing committee for inviting me. And I'm glad to be part of this great team and bring the customer and patient experience to the agenda. I will start my talk with the question. Imagine if today we call a form for patients or customer, as well as our healthcare providers, and we ask them share the stories with us. How much pain will be exist in this room? Maya Angelou once said that people will forget what you said, people will forget what you did, and they will never forget how you made them feel. So what's inject the system, what's made our system is emotions and feeling. How much you provide, what you provide is not that much important. And if we walk the walk of the patients or the customer, we can understand how much today we need to transform the system. We need to remember that we are a human who's taking care of human in the middle of tremendous amount of emotions that moved so fast between sadness and happiness at the same moment. We need to be aware and mindful that the current system is not helping us to move forward. And that's why we have the objective of the healthcare of the country for the healthcare system. And if you remember that the 4 goals, it's just we need to facilitate the access, we need to improve the quality, we need to improve the efficiency, and more important, we need to activate the prevention arm, not only treating the disease, as well as the pre-hospital care. So we need to reach out to the community. The quadruple aim for the healthcare for the healthcare transformation is just we need to take care of the quality, we need to take care of the accessibility, we need to take care of our employee or the care providers, as well as the efficiency of the system. I think it's not working. Okay, that's why we need to think about the system. So it's not only the human part, how much homogeneous the system is helping us to move forward and achieve our objective. Next slide. But I think they have a technical. Anyway, so moving forward and improving the system, today is a really historical day that we are talking about the human aspect. We are talking about improving the system, and we have something exist in our hands. That's the plan and the roadmap to move forward. The ACO framework that we are working under the umbrella of the healthcare transformation is focusing on all the aspects I've mentioned since we start this day: the leadership, the culture, the care delivery, the population health management, the enablers, that the e-health, the technology, as well as the income and the finance, the revenue, how we can generate the system. And it's very important that we need to make the integration of the care. To do the integration, we need to build the new capabilities. We need to think about the future. We need to think about the sustainability of the system moving forward. So if you can see the ACO framework, it's very clear that we have a clear, detailed plan to improve the existing system to move forward to the future. And in the middle of this is the care, is the care delivery. And we need a new capability that's taking care of the patient experience and the human side of our system. The new model of care, and this is very important, and this is a clear reminder to us all the time that we need to make the human at the centric. We need to take care about all the aspects, the human aspect, the physical, the mental, the socio-economic. We cannot do it alone as a physician. We cannot do it alone as a nurse. We need the all human within the system to make our healthcare system sustainable and curable and client-centric. So we have the activated person, and this is a clear reminder that whenever you are designing something new, you need to ask yourself, who is the product for whom? For a human, for another human. That's why I echo Dr. Ali's words that a patient or client is a part of the team. We cannot design something for us as a providers. We need to include the person. We need to ask them what you need from us exactly. And as I mentioned earlier, if we share the stories, and if we as a provider being a patient one day, we can tell that how much there is a fragmentation in the system, and how much we need to integrate the system, and how much we need to empower our community. Today, why we need the change, because most of the people, they are seeking the advice when they are already sick. We need to activate the prevention. We need to activate the wellness. We need to empower our community with a good source of information, accurate and within the time. Whenever we design a new pathway within the model of care that taking care of all the systems, starting from the keep well, planned care, safe birth, urgent care, chronic care, as well as a palliative, we need to remind ourselves that how is the journey of the patient from home to home with all the details, clinical and non-clinical. We need to consider all the human interaction. We need to consider all the ages. We need to consider that we are spoken a different language, and we need to, as a healthcare provider or healthcare system, to understand the unspoken language, the emotions, the interaction, the human aspect of us. And the digital and the platform COVID make it very clear that we need this platform within the system to help us to move forward, but as an enabler, is not it cannot eliminate or cannot replace the human interaction. And just imagine if today I'm alone talking to the camera in this room, it will be very difficult. And just imagine for the patient, if they're alone inside their rooms talking to a digital platform, cannot replace the human aspect, cannot replace the human interaction, cannot replace the humanity, because we are not taking care only about numbers or projects or screens. We are taking care about a human. So how to do this, or what are the aspects that we need to consider? The leadership the capabilities, the technology, as well as the training. In the leadership, we have to have a very clear strategy about the patient experience and how we can put it on the middle of the table and discuss it on regular basis. So without strategy, we're gonna move forward with the old system. We need an engagement management. We need to make sure that the voice of the client or the customer or the patient is heard and their human aspect seen. We need to have an advocacy. We need to have advisory. We need to enrich our research database. We need to make sure the change that we are made within the system is really fulfill the requirement of our community. We need to have a keynote speaking. We need to have like a matrix and to measure the maturity of the system, as well as we need to have the empathy. Our business is a human centric, so we cannot design something without seeing this aspect. We cannot design something, and this is a great reminder that whenever you design a project, whenever you put a plan, remember this is not a paper, this is a human project. So whatever keep you remember this aspect, bring it to your table and make sure that there is a clear interaction. Moving forward, we need a new capabilities, and thank you so much for the Healthcare Academy and the new people that we need, and new capacity we need within the system: data analysis, a coordinator, a data management, a decision maker unit, patient experience officer. And just emphasizing more, that the patient experience officer is a responsibility of everyone. So not all of us give a care because we have a physician with a certain subspecialty or nurse or whatever giving a certain care, but the patient experience is everyone's responsibility. And we need to be advocate for this aspect, and we need to bring all the things together. Technology is an enabler and just is another tool to make sure that we are communicating efficiently and effectively with the care guidance platform that consider the different language within our community from the different ages, communication tool, a real-time feedback. We need to have to make sure that we design the survey that targeting our community and our culture. We need to consider the innovation and the artificial intelligence and the importance to make sure that we are building a sustainable system for the future. The network is very, very important, and this is what we are doing today. We are sharing the experience because no hospital is similar to another, and no primary healthcare similar to other, no community is similar to other. So we need to learn from each other, and we need to maintain this kind of network. Training is very important and something continuous. We need to remind ourselves as a leader that how we talk with the human, how to consider this aspect is something very continuous. The frontline staff, they have the answer for many questions to be involved in the decision making, as well as the patient or customer experience, the advocate, the client. Everyone needs training to make sure that we are building the future together. Next. One of the best modality that whenever we design something new, because this is what we need moving forward, the 6 E's. So starting from the experience, we need to understand the experience from the perspective of the client, from the perspective of the patient, not from our perspective as a provider. We need to understand their emotions. We need to understand that there is a mixed emotions. What is a better experience for one person may be the worst experience for another person. We need to engage them. It's a very dynamic cycle. We need to make sure that every time there is a part for the client or for the patient. We need to make sure that there is a continuous education, because the population is get bigger and the complexity of the system getting bigger, as well as we need to make sure that our standard all the time, because we are taking care of the human, is the excellence and the evolution, and this is the continuous cycle. So this is not in a one stop or one step we did with a project. Every time as a leader, we need to take a responsibility. Whenever we design a project, whenever we celebrate a success, we need to make sure that there's a continuous cycle of improvement from the perspective of the patient. So I will end my talk with a kind reminder that again, we are a human taking care of the human in the middle of a tremendous amount of emotions that appear at the different times with a different perspective. We need to make sure when we are designing the future, the patient and the client is part of this. We need to hear their voice. We need to remember that the complexity of the system will the voice of the patient or the client lost in the middle. So we need to make them visible and on the table to make sure that we are designing the future together. Thank you so much.
Thank you very much, Dr. Samah. What a way to draw the map for the future, visible map. Dr. Samah, mashallah, she started by emphasizing on the quality, accessibility, and efficiency of the resources. Is another definition of planning. We categorize this through the population management, where we start from, what we are dealing with, and the care delivery, and all the way to the financial management. So that's what the other aspect of the patient experience to take into consideration, and that's literally the planned care, as she drew in a beautiful map. What got my attention too is the AI innovation, real-time feedback, and evolving. As the Crown Prince Mohammed bin Salman said, fears is not in the Saudi nation dictionary. Therefore, we are fearless to move forward because we have so much to achieve. We have a lot to be done to protect the health and to ensure the nation are looked after from all aspects. Thank you very much, and you deserve a break. Please engage, interact, network in this break, and we'll see you in 15 minutes with all our honorable guests together, Ustad Ayman, Dr. Ali, Ms. Samah, with Dr. Iman, to answer to a Q&A discussion. Thank you very much for listening, and we'll see you after the break. Enjoy your break.
Thank you, Mr. Yahya. Thank you all. I would like to thank all the speakers for the talk and discussion. Now, because we don't have much time, we want to take 2 questions to the speaker from the attendance. Anyone wanted to ask a question?
Welcome back, everyone. I trust you had a good break and fully refreshed for the most interesting and key stakeholders of the patient experience as well as the learning curve we try to promote and adopt for this specific area, which is you, the participant, people from multiple backgrounds and experiences. People have seen it, who are here to participate in person or online or virtually in Dammam and Jeddah. Your questions, your input, your clarifications is another valuable source for learning and understanding the aspect from the point from different aspects. We have Ms. Waad from Dammam. She'll have a question for our honorable guest. All the four speakers, thankfully, they stayed with us and they participate on this Q&A session. We have Ms. Modi from Jeddah and Ms. Raghat from Riyadh. Due to the time, we'll keep it to one question each, and we'll leave the panelists to decide the most suitable question for them to answer. Thank you, and the stage is yours, Ms. Waad.
Hello, I'm very pleased to be here today from Dammam. We had a very nice crowd today. Alhamdulillah, we enjoyed the forum very much. I would like to introduce Dr. Hatem Abul Huda Muhammad from Prince Sultan Hospital in Irara. To introduce the first question. He's the lead of patient experience at the hospital. It's my pleasure to introduce you. تفضل.
أيوة السلام عليكم. Thank you very much for this very nice meeting today. To be one of the attendants here. So I have, in patient experience, we have many questions, but we'll concentrate only on 2 questions now. She must. أول حاجة طبعا من خلال عملنا في البيشنت اكسبيرينس، فاحنا بنلاقي في الستاف الموجود في المنشآت الصحية دايما بيكون we fight with them to take any answer for any complaint. So how to make all the staff of the hospital or the dispensary to work as a patient experience member, and how to make them more encouraged to do more يساعدونا اكتر في الشغل بتاعنا تمام.
Dr. Ayman, you'd like to answer the question? Thank you.
مايك اوكي. يعطيك العافيه. Thank you so much for the question. انا حجاوب بالعربي ويمكن بحاول اسمرايز كويكلي بالانجلش for non-Arabic speakers. طبعا هذه المعضلة الكبيرة دائما انه اليوم patient experience department alone as a department غير قادرة على تحمل هذه الأعباء لوحدها، وخصوصا إذا كانت الثقافة مستحدثة في الانتيتي. ويوجد تحديات كبيرة أو في خلينا نقول صعوبة في عمل البالانس خلينا نقول التوافق أو التكامل بين different priorities، مثلا وجود السيفتي، الكواليتي وغيرها. والكثير يعتقد أنه اليوم البيشنت اكسبيرينس might impact بشكل سلبي العناصر الأخرى اللي قد يرى أعضاء الفريق أنها قد تكون أكثر أهمية، أو يرى أنه لا يملك الوقت to spend على موضوع البيشنت اكسبيرينس، لأنه ما زالت ينظر لها إلى أنه satisfaction و it's a nice to have أو شيء إذا عندنا وقت we will pay attention to it. أنا أعتقد في برامج كثيرة، يمكن كثير من المنشآت ما شاء الله تميزت فيها ويعني وحققت فيها يعني بروجرس عالي جدا ونماذج ودروس مستفادة من كثير من المنشآت، إنه يكون في اليوم في كل ديبارتمنت what we call PX champion أو سفير لتجربة المريض. على سبيل المثال إحنا عندنا اليوم مثلا في التمريض يكون عندنا سفير لتجربة المريض with a very simple recognition، يكون well prepared, educated, capable, enabled, trained في كل ما يتعلق بهذا الجانب in order to خلينا نقول نقرب وجهات النظر. يعني اليوم أنا as a patient experience officer قد أعتقد اليوم it's easy to implement a certain program from my perspective. Having champions from the same unit أو function helps us understand أو نفهم التحديات والعقبات وطبيعة الأعمال وتعقيداتها in order to design something with a better fit لهذه المسؤوليات الرئيسية. فهنا يكون فعلا عملنا وجهدنا براكتيكال أو منطقي وعملي. لذلك مهم جدا الآن أنه البرامج اللي تصمم أو الحملات اللي تصمم أو الانيشيتيفز أو whatever أنه it's designed with يعني خلينا نقول with joint efforts. يعني يكون في عندنا احنا concept الكو كرييشن اللي هو لازم نكون معنا المستفيدين اللي هم نتكلم طبعا عن our colleagues من other departments يكونوا engaged to design هذه البروجرامز in order ان احنا نصنع او نخلق برامج فعلا تحقق الأهداف وليست فقط يعني شكلية. يعني وهذه يمكن الإشكالية اللي نواجهها يمكن كثير إنه في مبادرات وأطلقت مبادرات ونشجع صراحة وننبسط لما نشوف هذه الإكزامبلز، ولكن we're trying to create a real impact. يعني صعب اليوم إني أنا أضع بريشر على الفريق ويخرج بي نتائج مؤقتة فقط the sake of reports وأرقام، ولكن على المدى البعيد we cannot sustain it. But I think it's very important to work with the concept of partnership مع الزملاء والزميلات في الإدارات الأخرى in order to create something practical و useful. بترك المجال للدكتور علي لأنه I think إذا كان أوكي الله يعطيك العافية. شكرا لك.
Very interesting question and well detailed thorough answer. Thank you, Doctor. And now we move.
سؤال تاني. تمام؟ هو واحد بس. أقول يعني. When there is a complaint about يعني لو في شكوى عن خطأ طبي عند مريض يعني فالتعامل معها يكون بس هل إداريا فقط يعني يتحاسب الطبيب على الشكوى بتاعته كده ولا نمشي معاه في الإجراءات الطبية برضه عشان يتعالج حتى لو البيشنت مش مركز في الحتة دي قوي يعني البيشنت ممكن يكون مركز بس أنا عايز تشتكي الدكتور يمشي الدكتور كذا.
شكرا يا دكتور. If you allow me to save this question until we go through the other cities and then if we have the time we'll go back to this question. Appreciate it, Doctor. Thank you. Now we have Ms. Ragad in Riyadh. Thank you.
يعطيكم العافية جميعا. شكرا للسبيكرز طبعا وشكرا للأستاذ يحيى معنا هنا في الأكاديمية. في questions هنا one question من ريهام من أكاديمية القيادة. إذا ممكن تفضلين معنا ريهام.
السلام عليكم. سؤالي كان what is the challenges patient experience leaders must overcome. يعني مثل ما قلتي إن المجال جديد وأي برامج تصمم في هذا المجال لازم تكون يعني more practical more deep in this. فأحتاج جواب لهذا السؤال إذا ممكن.
الله يعطيك العافية. شكرا لك. طبعا again يمكن it's related to the first answer for the first question. It's always having the competing priorities. يعني اليوم نتفهم جدا أن القيادات or leadership they have competing priorities and they try to balance as much as possible. It's very important to support them. If there is a program dedicated to for leadership specifically to explain the concept of patient experience and how is that related to better outcomes to the organization. It's very important to tie the practices to results. It's important to show how patient experience will result into cutting costs, how patient experience will result into gaining the trust within the organization. How is that going to create a sustainable impact? I need to hear from Dr. Ali, and I think he has a great experience on this area, and maybe you will add something.
Thank you very much. The very important question I understood when you mentioned the question, Mr. Riham, you know, there is sort of a program for educating leaders about patient experience, which is very important from the educational aspect. But however, it's not enough because, as I mentioned in the presentation, patient experience is on-ground work. It's not just of theoretical part, although it's very important. So it is important that the organization believes in patient experience, and the leaders of the organization, I mean like the CEO and others, they believe, the key leaders, they believe. We had the experience when we started patient experience 2013. The first thing I did when the CEO told me to take over, I said I need to meet all the middle management and the upper management leaders to get their commitment. And that happened overnight. In one night, I remember, I think it was Tuesday in November 2013, we met for 1 hour, 90 leaders, and explained to them what patient experience, and I took their commitment that you have to be supportive of this. Because even if you have the best knowledge in the world, but when you go to Department X and the leader or the head section does not believe in patient experience, you cannot improve patient experience in that department. So it's very important that you engage leaders, you explain to them why we are here, what's patient experience, what's your role in it, and so on. Otherwise, it will not, the leaders will continue facing difficulties, challenges, then they will be stressed, burned out, then they will leave the whole business and they say, we failed.
MashaAllah, thank you, Dr. Ustad Ayman, Dr. Samah, if you'd like to comment or in this question before we go to Jeddah question. Because I don't see you and I want to be fair and I give you the opportunity. Thank you. So we'll go to Jeddah. Ms. Modi, the stage is yours.
Michael, you can't hear me, Mr. Yahya? Hello?
It's clear, Doctor.
Clear. Thank you very much. Yeah, I want to emphasize about what Dr. Ali said about the leadership program education. And it's now available in some institution USA like Broad Institutes. Also, yes, if you don't believe, if the CEO and the top leaders don't believe on patient experience, it's not going to be implementation. Whatever you do, as Mrs. Iman said, you have campaign or you have awareness program, but in the end, this is what I said in the beginning, if nobody gives you empower, so you cannot really do the implementation in the right tracks. Also, regarding these things, you have to go and ask the employee themselves. You have to survey the employee. Now you want to engage the leaders. You want to engage the staff, the front staff. So you have to survey. You have to send them survey. Ask them, what do you need for us as a leader or CEO? So you can engage with us. What you need, so you will buy in, and you will be with us in the same pathway. I think it's very important to hear first. Is that a survey is not only for the patient and hear from the patient. We have to hear from the staff. In the end, what we have in the survey is like a promise for the patient. And then we have to keep our promise. So it's the same things. We have to do the employee as our internal client. So we have to ask them what they need. Then we take it as a promise for us to do. We'll do for them, and then we'll ask them to buy in now. Thank you very much.
Thank you, Ustad Ayman.
Thank you so much, Dr. Ayman. This is Modi Srahid from Jeddah. I would like to thank you all for participating in this forum. Let me introduce Ms. Alia, Patient Experience Director from مستشفى الفقيه from Jeddah.
Good morning, everybody. My question for here today is that once we finish this forum, how can we collaborate more together? How can we implement the MOH's vision to our institutes, especially the private institutes? Because a lot of what is said is a lot in the governmental, but we need also to start implementing these things and collaborating together in the private sector. So where do we go after this forum? This is my question. Thank you.
Very nice question. Who would like to go first? Thank you, Dr.
Thank you so much. Very important question. Thank you for raising this. We have started from our part as Patient Experience Center in the few past months to engage the private sector. We've created a network with the private sector to exchange and share excellent practices and exceptional practices within patient experience. We're also sharing what we have gained so far and all the initiatives that started since the beginning of the program. We'll be, inshallah, moving towards a very important step, which is including the, let's say, phase one healthcare facilities in the private sector into the patient experience measurement program. So they will be part of the program where we can now raise the bar a little bit and have the benchmark against the private sector. And we know for sure that they've been working on this previously, and they've made progress, and they're pioneer in this area, and we want to make sure that we work all together as one team and learn from these excellent practices. So we welcome any private sector who wish to join this network. We're happy to share what we have accomplished so far, what are the challenges we're facing. And I second you. Yes, this is very important. We need to make this step forward together, and we're here to support. So I'll be happy to share my contact information. If you need any support from our side as Patient Experience Center, I'll be happy to do it. Dr. Ali and Dr. Sama.
Thank you, Ms. Iman, for the great answer. I want to add that after like 6 or 7 years of practice of patient experience in the country, I think we reached a maturity level where we need to work together. What's happening now is either institution-based or sector-based practices. We know that Minister of Health takes care of about 60% of healthcare in the region and in the country. Private is 10%, and the rest is between the military, university, and others. So we need to work together. So we need to move to a country level of business where country level strategy, a country level objectives, a country level standards. Now, if I want, as a patient experience practitioner, probably this is true for everybody, if I want to check the standards for any practice, I go check Burrell Institute, I go check Cleveland Clinic, Mayo Clinic, that's great, but we just mentioned that we have different culture and different, probably what will succeed there or what have succeeded there is not proper for our culture here, or it needs sort of modification. So why don't we develop our own and build on the great business that has been done in Ministry of Health and in the National Guard and military, but it is silo-based. We need to go together and raise the level to a country level. And I already started that with the help of Ms. Iman, and we are, I'm working with the Saudi Health Council to have sort of business at the level of a country. And hopefully that will have a positive outcome, inshallah.
Thank you so much, Dr. Ali and Ms. Iman. Adding to this, we need to take this opportunity to move forward as one system, as you mentioned, as a country, because we may have an opportunity for the private sector to improve, as well as they have an opportunity for us to improve. So if we don't have this collaboration and connection and network, the complaint will be a complaint that go to the drawer without any improvement. So we need to have this kind of communication and network to improve together. Thank you.
Thank you very much, everyone. Mr. Iman, Mr. Ayman, Ms. Iman, Dr. Ali, Dr. Samah, it's been a pleasure. We are honored to have you with us. And this is a start of a long journey, and we'd love to see you again. And thanks from me and on behalf of all my colleagues in the Health Academy, the Saudi Commission, and the nation. Thank you very much. Really appreciate it. Thank you. We will move to Dr. Amira Clinton, who is our Executive Director of the Curriculum Developments. She's an expert person I come across who has linked the practical on-the-ground experience to the knowledge sharing from the ground all the way to the global brands. Dr. Amira, she's been helping us with the about 34 program now we are working on, and she is one of the international exposure she had in Australia where she educated. She came from an ER background, but she has been a great, tremendous help for all of us. Dr. Amira, thank you very much for joining us. The stage is yours.
Thank you, Yahya. First of all, I'd like to thank you all again, all our distinguished speakers who came in today and share their all experiences that they have, and all the great attendees in all different locations. We really appreciate your time and the great discussions. I'm sure here in Dammam we had a lot of great people around and networking and talking, and I'm sure it happened in all locations as well. We wanted just to close this up to make sure that we put it all together as well. And I think it was a great segue from Dr. Alia from Jedda's question and how we go, what's next. So we wanted to link this all together. And what is the essential role of education in the healthcare transformation and the patient experience and putting it all together? So since morning, everyone has been talking, and can we go to the next slide? So we were talking a lot about the transformation. So, and what is transformation in general? Transformation is to move towards something new and to be transformed regarding a change or what we need and a certain vision towards. And usually a transformation is needed for certain situations and criteria as well. So if we can go to the next slide, the important part about what we're doing about the transformation is about the vision that we're all working towards, which is the vision of 2030. And there's a lot of talk about what you want to do, and the transformation is happening on multiple levels. And we want to focus today on transformation within the healthcare system and also what's related to education and patient experience as well. So, I apologize for that technicality. So today we're talking about some 3 transformational stories. Most of it already were mentioned, so I'm going to just put it all together again. But the transformational stories that were mentioned today were about the healthcare and patient experience, and I'll talk a little bit more about the education as well. So in the next slide, regarding the story of the transformation within the healthcare. So moving to the next slide, when we talk about the healthcare transformation and the vision, and most of you already are aware about this, is what are we shifting towards and why is it needed? We're currently living in a VUCA world, which is very volatile, complex, filled with uncertainty and ambiguity as well. So as we move forward to a healthcare system that is becoming more and more complex, what are the competencies needed for us to work within it and how to navigate within this complex system as well? So there's a need for some mindset shifts. And these mindset shifts, it makes it important for everyone to be a change agent, because we are all involved in this transformation and we're all involved in this complex system. So we need to think about ways, how can we move towards and shift our minds and be a change agent towards enabling the transformation that we are working towards as well. The next slide we're talking about the 3 Ps, which are the stakeholders that we're working within this healthcare system. So we work with providers, patients, and payers, and that's a complexity that we're working with at the moment. So, and we can see that the patient is a really important cornerstone and stakeholder, and that's what we're talking about, the patient experience. But that doesn't take away from the providers, who are us and everyone here with us today, and how they are providing that for everyone as well. So the healthcare system is becoming complex. For that reason, they're introducing new health system sciences. So health system sciences is to make sure how do people understand how to work within this system. So it's very important for everyone also to understand the system, to enable them to work within it and to enable this transformation as well. So as we move within this story as well, we need to work with the quality, which was the AHA quality needed triangle about per capita and having the patient included as well. Our current healthcare transformational story focuses on improving healthcare, improving health itself for patients, and improving the value, and having it within a value-based healthcare. So that is a story about the transformation that we have at the moment. So we'll move on to the next slide, is trying to link it to what is the story about the education. So what is the educational story, and what is about training that we want to link it towards being us at the Health Academy, and why we brought a lot of expertise as well. So history of medical education in the next slide shows that in general, the training, and you think about it within the healthcare sector, it all started within persons and silos. If we can go to the next slide, and we can see that it started all theoretical and a philosophical subject. So everything was theory in the beginning days of the centuries when Socrates and all, there was all theories. What is education? Theories about medicine, theories about practice. After that, it shifted towards the modern hospital. So a lot of things became to practice. Before the doctor used to go to the patient, now patients comes to physicians and to an institution to get their treatment. So it became a scientific subject. So people now got trained in areas rather than going along with an expert. After that, it shifted towards universities and became an academic freedom. So universities now are the people who are responsible giving the education and training. However, that created a silo because universities, in a way, sometimes are away from the actual practice and people clinical who are in the field and know what is needed. So that sometimes creates a gap in what people are trained towards graduating or not. As we move forward, we identified that anyone who to be able to work in a healthcare system needs to have certain knowledge, skills, and attitudes. And we need to know how we can shift them from essential skills and competencies to become enhanced until they become experts as well. So taking that into the context of our transformation, the next slide, we want to make sure to identify a competent-based medical education. So it's been done in a while, and you can see when you teach someone something, that doesn't mean they actually learned it. And that's what happens during a lot of educations, if you agree with me, that when you actually explain something, it doesn't mean that the audience or the learner, the perceiver, actually learned it. So making sure that whenever training you design, the people who you want to graduate to achieve and make sure that they are ready to enter the workforce or actually have the appropriate competencies that are needed. So that is about the competency-based medical education. So there are different ways that you can link that together. And here comes the story of how education has evolved, because education should evolve. And that story of the educational transformation is important to make sure we are up to par and we can keep up with all the changes that are happening within the transformation of the healthcare system. So the training needs to change as well with what is needed within the training. So having on the right is the current, which is a basic educational model of designing curriculums. But we need to combine it with something else that enhances change, which we have Kotter. And if those who are familiar with Kotter 8 steps of change management, so because education can enable and help change as well. So how can we combine those together to make sure that we can transform the education to the current need? So that is the story of the education and how we want to transform it as well. So the last point, okay, we want to make sure, and this goes very clearly, closely with that last discussion that we just had, is creating communities of practice. We work in silos, and a lot of expertise here today, and we try to not create it, but we have people in Dammam, people in Jeddah, people in Riyadh. So how can we cross over and share our expertise together? So we want to make sure there are areas of training hubs that people can connect together and create a community of practice. So the definition of community of practice in the next slide we have is people who are experts who join and sit together and actually discuss ways for improvement. And that's one of the major aims that we want to make sure that we connect people today, to create this community of practice that can discuss and identify what is needed. People with different experiences, different backgrounds, but have the same passion and the same aims towards doing that. We really hoped from today's meetings and today's forum that we start creating that connections with everyone to create that community of practice. So in the next slide, so again, the community of practice is joining people with common interests, common improvement, and share experiences together. So we want to make sure that this continues as well. So after this, we have the patient experience. And this is actually not my area of expertise, but this story of the transformation of patient experience has been told since we started 9 a.m. with Dr. Wolf. So the patient experience story of the transformation was started. We all already, Dr. Wolf was kind to give us a global perspective, how it all started. Mr. Ayman was very kind enough to put it within our culture need and culture basis as well. We moving or knowing from Ms. Iman what are the local changes that are needed within the ministry, what is the aims and goals. Dr. Ali shared his experience putting it all together within the teams as well, creating a team of patient experience to move it forward. And Dr. Samah was put it within the bigger picture of the transformation. So the story of the patient experience was already told today. And we're very happy that we were able to listen to it and understand how it's all started and connected it and putting it all together. So because the patient experience is something broad that is connected to everyone, linking it to the model of care, to the transformation again, and emphasizing that the patient and the activated citizen is the person is in the center of this transformation and change. And that is the story that we wanted to talk about today. So in the next slide, putting it all together about the transformation story, the educational transformational story, and the patient experience transformational story. So all these stories, we don't want them to stay in silos. We want to make sure that they become connected, to move forward, to make sure that all of us can be able to do the change. So in the next slide, I would like us to make sure and emphasize let's start our story as well. What is our story in the kingdom that you want for the patient experience? Linking it to training to start it with everyone's different ideas and expertise, putting it in the local context, putting it to enable our transformation and vision of change that we want. We want to work together as a community of practice to write that story together, to be able to share it with our success, because we have a lot of great passionate expertise with us today, and some of them who unfortunately weren't able to join us today, but we're very happy to believe that they were able to join us virtually as well. How can we make sure that we write this story? Why is it important? Because we are the people who are going to lead this change and transformation. So I'd like to all thank you again for your time. Thank you for coming today, and we want to make sure we stay connected. We want to make sure that we work together for the transformation and writing this a great success story for patient experience, either through training that we can help with, or whatever communities that you work together to make sure that we excel within that. Thank you all.
Thank you, Dr. Amira. As usual, we're constantly learning from you. I personally, and all our colleagues at the Health Academy, we are honored and grateful for all your support. Thank you for all our speakers, our guest participants in YouTube, on site. I believe we have managed to establish a patient experience community, something Dr. Jason has been doing for the last 12 years globally. He's engaged with us now as one of our international partners. We signed an agreement with them to collaborate on a longer term. And the one fact I can tell you that our leader promised us this is not the first patient experience forum, is one from many to come, and not the only topic. We have mapped about 9 international partners. We are getting them engaged to deliver forum, hopefully every quarter. The valuable input and insight we had from our guests, it just can only be summarized as a start, and a good start is a half of the success. Our leader in the Ministry of Health, our center, head of our center, Patient Experience Center, driving the strategy. Our model of care, Dr. Samah, and her emphasis on collaboration, Ustad Ayman, and his interest on making sure the culture as a competencies and a core to add to our journey. And as Dr. Ali mentioned, the engagement, involvement from the management. He, mashallah, remember Tuesday, November 2013, because that's an important step. The first step to get the engagement of your management, of your leaders. Get them on board. It's not one-man show, it's not one-person show, it's everyone part of it. And from the patient experience, da'wah salihah can go all the way. A patient can go through a suffering journey and finding someone who cares from the heart. They would appreciate this, and you never know how far can go their prayer for you. There's nothing for me to add but to thank Dr. Mustafa. He's the one I've been taking the credit from. Actually, that's his forum. He organized this from A to Z with the help of Abdul Aziz and her team. And without the flexibility and support, continuous support from our CEO and Abu Abdul Karim, Dr. Ayman, we couldn't go this far. This is a start. We have more to come. And very, very honored to say, guys, this is the start of being part of the transformation. It's not the Ministry of Health job alone. It's not the private sector alone. It's everyone's job. And everyone will benefit and see the impact on the ground. Please help us, share with us any research, any study for our next forum. You are key stakeholders for us, and we welcome you, and we thank all the healthcare workforce. We made everyone proud through the pandemic. They put themselves on the front line. People go away and stay away from the virus, and they went to the front line. And the impact of this made everyone to be proud of the healthcare workforce. We thank them, we appreciate their help, and we hope to make sure they're always honored and appreciated. Thank you very much. Thank you. My apology, I forgot the team, my apology. Without their organizational skills and commitment, last night they stayed till midnight, I think. Thank you very much for the team, appreciate it.